Assalamu alaikum. So let's start to the play series. So now we are here to differentiate constrictive pericarditis and cardiac tamponade. So what is the constrictive pericarditis and cardiac tamponade? So we can differentiate it. So let's begin. Now the definition that, for example, this is constrictive pericarditis. So what happened in constrictive pericarditis? There is a calcification occur in the pericardium. For example, here is a thick calcification occur in the pericardium. So here is a thick calcification occur in the pericardium. Thick dystrophic calcification occur. In the pericardium that will obstruct the heart. So what happened here? Let's assume that, so here is right atrium, here is right ventricle, here is left atrium, here is left ventricle. So if the blood comes here, so the right atrium drain into right ventricle, so the blood can be full of here, so less cardiac output. So what happened here? So what about the cardiac output? So the cardiac output is gonna be decreased because less blood come in and the heart is not to relax properly. Why? Because due to constriction obstruction, so cardiac output is decreased. So what happened to BP? The pressure is decreased. So we hear the formula: if the BP is divided by cardiac output multiply TPR. If cardiac output decrease, BP will be decreased. So the cardiac output is going to be decreased, the BP is also be decreased. What about the heart rate? The heart rate is going to be increased. Why? Because the baroreceptor sense that the cardiac output and BP has decreased, so they send a sympathetic fiber and act on a beta 1 receptor and constrict the heart to increase BP. So we found that heart rate is increased. What about CVP? What about CVP? And what about pulmonary capillary wedge pressure? So basically we say that CVP is measure the right atrium pressure. So when we measure the right atrium pressure, because the left the blood cannot pump properly, so the blood can rush and pull up here. So here blood is pull up, so their pressure is increased in the capillary wedge pressure. And the pulmonary capillary wedge pressure, so we found it in the left atrium, the pressure will also be increased. So the left atrium, the pressure will also be increased. So here increase. So what about the total peripheral resistance? What about the TPR? So the TPR is that the baroreceptor sense that the heart rate beta 1 receptor act on, so the heart rate increase. If now they act on beta 2 receptor on the vessels, so the vessels also be constrict. So if the vessel constrict, the TPR will be increased and increase BP. So the constrictive pericarditis, here is changes, and their changes also occur in the cardiac tamponade. What happened in the cardiac tamponade? So here is a thick calcification occur. So here is a fluid accumulation. Here is, so here is a fluid accumulation in the pericardium. What happened here? Fluid accumulation in the pericardium. So mechanism is fluid accumulation in the pericardium. As I said earlier, here is a Beck's triad. What is the Beck's triad? that the hypotension occur, drop BP. Second one, here is a pulsus paradoxus, and the third one, there is a muffled heart sound. Muffled heart sound. So you see the differences between the constrictive pericarditis and cardiac tamponade. So here the cardiac output, BP, heart rate. So let's proceed further. So now Kussmaul sign. So Kussmaul sign and pulsus paradoxus. So what in the Kussmaul sign, the constrictive pericarditis is more. Why? More and present. Because what happened in the Kussmaul sign, if inspired in the inspiration, there is raised JVP because here is pressure. So in the inspiration, here is raised JVP. So we call it Kussmaul sign. And Kussmaul sign is absent on cardiac tamponade. And now the pulsus paradoxus. Pulsus paradoxus may be less common, maybe or may not present into constrictive pericarditis, but it is more common in cardiac tamponade. And what is called pulsus paradoxus? So again, pulsus paradoxus. So on inspiration, normally on inspiration there is systolic BP drop less than 10 mmHg. If greater than 10 mmHg, so we call it pulsus paradoxus. So what happened here? Let's assume that if we inspire, the heart will become relaxed. So the heart will become relaxed. So in the right ventricle, the pressure is going to above the septum. The septum will shift toward little bit here. So the septum will shift toward little bit here. So what happened? There is drop cardiac output. There is a drop BP is less than 10 mmHg. In the cardiac tamponade, what happened here? In the cardiac tamponade, there is a fluid accumulation. So if we inspire, the pressure goes onto the septum and the left ventricle, and here is less fluid, less blood. So the less blood is going to become drop. So the greater drop become to is the cardiac tamponade. So we call it there is greater than 10 mmHg drop. So we call it pulsus paradoxus. So there is another differentiation also occur. And what is the another differentiation? That in the constrictive pericarditis there is lub knock present, but here is friction rub present. On ECG, there is a low QRS because on ECG the electro waves are not goes to the heart because there is a thick pericardium. So we here in the ECG we found that there is a low QRS, and here also low QRS but electric alternance plus electric alternance. So there's a major difference between the constrictive pericarditis and cardiac tamponade. Now let's move further on. So now we do X-ray. What happened to X-ray? So the cardiologist point here is if the calcium around the heart, so we found that there is a bottle like. So for example, this is a bottle. For example, this is a glass and this is a water. So we described as water bottle appearance in constrictive pericarditis. Water bottle appearance in constrictive pericarditis. And the X-ray may not present because there is fluid, so fluid appearance. And what about the apex speed? So if we found the apex speed, so here is impalpable apex beat, impalpable apex beat present or absent apex beat. Here is displaced apex beat, displaced because here is fluid, displaced apex beat. And now move further on. So what about the sound? So here is a knock sound, or here is a muffled heart sound. So and what about the treatment? In constrictive pericarditis, we do pericardioectomy. We remove the pericardium. And what about the cardio temponade? We do pericardiocentesis. We remove fluid of pericardium. And what about causes? So here the causes is chronic TB, and coccidomycosis, etc. Here causes is RTA, road traffic accident, stab wound, etc. So here is a major differences. So there is a flap series